Thank you very much for joining us here today. I'm happy to be here with Dr. Vesta Michelle Warren, President of the Alberta Medical Association. And we're here to announce a new agreement between the Government of Alberta and the AMA. Through a ratification vote that ended yesterday, physicians across the province voted to support a new agreement. It's a step forward for physicians, for patients, and for our health system as a whole. The agreement is a foundation to build on, to build the kind of relationship I want and our government wants with physicians, and that I think physicians want with government. It embodies the respect that all of us as Albertans feel for doctors and the tremendous work that they do, more than ever through the last very tough 2.5 years of COVID. The agreement will ensure that compensation to Alberta physicians remains competitive, but quite frankly, it's much more than that. It's about working together to serve patients better across our entire healthcare system. A lot of work went to getting us to this day, and I want to start by thanking Dr. Warren for her leadership and that of her bargaining team. The process had to start with two things. First, we had to build good faith and trust. And I've had that with Dr. Warren. And it's been really an honor to work with you throughout the last year. And I look forward to working with your successor, Dr. Rinaldi, in the year to come. And second, we had to listen to physicians and to the AMA. Everything in this agreement followed from that. It's about working in partnership to address the concerns that physicians have brought forward. Partnership is embodied in this agreement in a number of ways. First, there are specific processes for us to work together to resolve outstanding issues, including stipends, overhead and Z codes, caps to daily visits, virtual code enhancements for psychiatry, and extending physician support programs to medical examiners. Second, it includes a commitment to bringing any issue affecting physicians to a joint master committee. It includes express recognition for the needs for physician expertise in designing alternative payment systems and other structures that they work in. Where there's disagreement, there's a process to resolve this with binding arbitration. And it commits both parties to shared objectives. It includes gain sharing, where there are savings identified through the agreement, we will share them equally between government and physicians. Now, as part of this agreement, the government will repeal legislation that gives us the ability to terminate compensation-related agreements, and the AMA will stop the lawsuit against the government in this regard. The agreement is an important step forward because there's a huge amount of work that we need to do, and we need to do it together. As I said last week in announcing the primary care project, we need to do two things, and they really apply to physicians and the health system in general, as well as to primary care. We need to act urgently to stabilize the system and address the pressures that have increased with the pandemic. And we need to plan for longer-term transformation in physician practice and in the wider health system. And this agreement helps us do this together. The agreement recognizes the impact of the pandemic on physician practices and provides an injection of funds to stabilize them, concentrated on family practice where the need is the greatest. It also includes support for business continuity and lump sum payments. It recognizes the need to fund volume growth and complexity. There's no cap on total physician services budget, no budget risk or liability for doctors in this agreement. It recognizes the need for renewal in primary care through distribution of annual increases and an injection of fund into primary care networks, PCNs. Given uncertainty about the future, it provides fair process to determine rates in the 4th year of the contract. And there are also new initiatives to support rural recruitment and retention. The overall agreement will provide an additional $750 million new dollars over the course of the next 4 years. Now, specifically, the overall rate increase is about approximately 4%, in line with other recent collective agreements. However, the increases are not the same among all specialties. Family medicine will see an effective increase of 5.2%, including rate increases and other investments. Other specialties that will see larger increases are neurology, pediatrics, obstetrics and gynecology, and psychiatry. And this was really important item for the AMA, and we worked together to actually build this agreement. There will also be a 1% lump sum payment in 22-23. In addition, there will be approximately $250 million in new spending over the 4-year term on targeted initiatives in areas physicians told us were important, like supply in rural areas, practice viability, and supporting business costs. Targeted annual investments over the 4-year term include $15 million for physician recruitment and retention, $12 million for rural remote northern program, $12 million for physician support programs, and $20 million for the business cost program. And just to be clear, this is in addition to the funding we already provide for these programs. The remainder of the increase in $250 million targeted funding will go to one-time investments in change management supports for physicians considering alternate payment models, and to support physicians adopting new information technology systems that improve patient care. There's also $40 million in the new agreement for primary care networks to support family physicians. There will also be another $2 million increase in funding for the Reside program that provides incentives for family physicians to practice in underserved rural and remote communities. In years 3 and 4, we are committing to a minimum level of spending on physician services, which will grow each year based on population growth and changes in health needs. Physicians will be actively involved in shared responsibility to review compensation rates in year 4 relative to the market to help bring them closer alignment with Ontario West jurisdictions. A global rate adjustment will also occur in the 4th year to reflect general economic and fiscal conditions. And this agreement is much more than just these specific investments, as important as they are. We're taking real steps forward in addressing issues within medical practice that have been needed for decades, including internal equity, in particular the need to better recognize the value of general practices. We're also moving forward on alternative models of compensation, again, especially in family medicine, to make sure it remains attractive to the next generation of medical students and residents. And we are also undertaking a review of the effectiveness of our current support programs. We need the agreement to address issues in physician practice, and we need a renewed partnership with physicians to work together on the wider challenges facing our healthcare system. Now, 2 of our most urgent issues are the need for more access to primary care and the need to recruit and retain more rural physicians. AHS has had success in recruiting to many communities like Medicine Hat, Lethbridge, and Lloydminster recently. But the past 3 years have been tough, especially in smaller communities, and recruitment of rural physicians is harder than ever. We need more doctors in the smaller communities across the province, and the agreement will be a boost to our recruitment and our ability to be able to succeed in this area. We train the best doctors in the world, including the best rural doctors. And we're one of the, we are the most welcoming province in Canada for internationally trained doctors who are critical to many of our small communities. And this agreement will help us support them. We need to renew and reinvest in family practice and primary care, and the agreement will directly support that work. We need to add capacity across the system and keep working towards the goal of better access to scheduled surgeries and other care that we had before COVID. And more broadly, in order to do any of that, we need to rebuild our health workforce, including doctors. And we need to send a message to young people in Alberta across Canada that this is the best place in Canada to build a career in healthcare, whether in medicine or nursing or any other healthcare profession, because we are investing in our healthcare system. Now, since January 1st of this year, we've supported AHS in signing new collective agreements with all 4 of the major groups of healthcare workers, RNs, LPNs, paramedical and technical professions, and support workers. But there was one left, this one. And this agreement is important to doctors, it's important to patients, it's important to Albertans, and I can tell you, it's important to me. So I'm honored to stand here with Dr. Warren today and announce this agreement. And I'm honored to support our doctors and everyone in our healthcare system and the work that they do for Alberta patients every day. So thanks again to the AMA and doctors for ratifying this agreement. And thanks again, Dr. Warren, for your incredible work and actually making this happen. And now I'll turn the mic over to you.
Thanks very much. So I'm very glad to be here today. It has been an incredibly long journey. And I want to thank the physicians, our resident physicians, and our medical student members of the AMA for their support over the past 3 years, and for everything that they do every day to serve patients. not to mention everything they've had to do through COVID. The contributions have been and continue to be remarkable. The care that you see today in our system is because of that passion and that commitment to doing what is necessary for patients. I also want to thank Minister Copping for his efforts to rebuild a relationship in which interest-based negotiations would be possible. His spirit of collaboration and drive to rebuild really has made a world of difference. We've achieved an agreement that is good for physicians, it's good for patients, and it's good for the healthcare system that supports them. Because that support is not only a good thing, but it's a necessary thing. There are many large issues facing us, and this agreement just sets us on the road to begin to seek solutions. We've seen what happens when we work in silos and isolation, and it doesn't end well. We have to work together because the healthcare system is everyone that's in it. It's doctors, it's nurses, it's our support workers, it's community practices, it's health, it's AHS, it's lab. You name it, we're in this together. When I think about the public that's listening to this news conference, I think there are 3 provisions that matter most. Number 1, Albertans want to know that their physicians are fairly compensated so that they can continue to maintain their businesses, which are their practices, and care for them. This agreement does provide increases that are in line with other recent public sector agreements, but it is the beginning. There are valuable programs in this agreement that will also help, including a significant increase to the business cost program. And that's very important to physicians who, like other Albertans, have been struggling with rising costs for their businesses. These provisions will also help stabilize physician practices that our patients rely on. And this is important for not only the patients, but for the ability to attract new physicians into Alberta. And if we don't retain the physicians we have, why would you come into a boat that is leaking out the back end? So I think the challenge facing Alberta and all provinces and territories right now is there is a shortage of healthcare workers across Canada and even globally, and the competition is going to be fierce. This agreement will provide stability, and that is key to begin to attract more in. And the provisions will help us remain competitive. And we need to look forward and move forward as we work with government and all our stakeholders involved in creating solutions to problems that began before COVID, that were plaguing primary care before 2019, because we don't have those answers yet, and we need to look to them. Secondly, Albertans need their physicians and government to be able to work together in the interests of patient care. And this agreement does establish fair processes to do that, to work together, including physician compensation and new ways to pay physicians that reflect the changing needs of patients. In a complex system, disputes may arise, and this agreement does have robust dispute resolution mechanisms, so we can keep moving forward on other matters. And finally, this agreement restores the structures that have been lacking through which physicians can have input into decision-making within the system. And I'd like to point out that through Minister Copping's efforts last fall, we've begun to do this even before the agreement was ratified. Because it is important to bring expertise in when we are dealing with these significant challenges, because it is such a complex system. We know that primary care has been struggling in the community. We know there's massive pressure on our hospital systems. We know there is backlogs in emergency departments, but we see this across Canada, and we need to work together to find solutions for Albertans. And the Alberta Medical Association looks forward to working in partnership and collaboration together with the Government of Alberta to find a way forward together. Thank you.
Thank you very much. Thanks. This begins the formal portion of our announcement. We'll go to the question and answer portion. Starting with those on the line. Operator, can you put through the first caller?
Timber, TTV. Hey, thanks for taking my question. A question for you actually, and you answered separately. You talked a lot about Mr. Copping, the relationship between the two sides, different parties here. I just want to know, what's the relationship like moving forward right now? I understand what you're striving for, but the current relationship, what's it like now that this deal has been reached? I guess to the AMA, how are healthcare professionals feeling as we head into the autumn and winter minister about that relationship?
Well, thanks for the question. So when I came into office as the Minister of Health, and Dr. Warren, actually, we both tell this story. Is even though I called her predecessor, basically, that was my first phone call to an external stakeholder, and her predecessor said, "You need to talk to Dr. Warren, who's stepping into the role." But it was really about we need to work together. We need to work in partnership. There are challenges facing our healthcare system. And this is a healthcare system which is supported not only by government, AHS, doctors, nurses, but we need to be working together. And how do we actually move forward to improve the relationship? So I would say that we've actually made steps forward over the last year to improve the relationship. Part of that was actually getting into an interest-based process. Looking at the interests of government, the interests of the AMA, and what we found through that process. There are many overlapping interests. Actually, we have more in common than not in terms of how do we provide better care, sustainable care over the course, and we need to do that by working together. And what this agreement, so I would argue that there would be, there has been an incredible improvement in the relationship over the past year. We've been working together on items, conversations regarding how do we actually address COVID, how do we actually address some of the challenges we're seeing in the emergency departments, ongoing conversations back and forth. And then this deal helps improve that, because what it also does is it's not just about the money in the deal and the commitment to innovation and stability, but it's also about the process in the deal, that we are actually going to work together. And it sets out that process. It puts mechanisms in there in terms of the master committee that's part of the agreement. And I look forward to continue to work with the AMA in leveraging this agreement to continue to build the partnership, because we have some challenges and significant challenges that are facing our healthcare system. But I know that we get more people at the table. We can share the ideas. We are going to be more successful in addressing those challenges. And when we put something in place, if it doesn't work, that's okay, because we're going to change it until we do get it to work. But you need the relationship and the trust to make that happen. I don't know, Dr. Warren, if you want to comment further on that.
Yeah. So the way that I explained it to physician members is, without an agreement, there is no process by which change can happen. There is no place to come forward to with member concerns other than through reaching out, email, phone. With Minister Copping in his role, I was able to reach out many, many times. My husband would say I probably speak more to Minister Copping than him. But as a means of networking together, those specialists on the front lines that were seeing issues in real time, that it was imperative that we see action, but had no way of reaching through. So we were able to connect those physician leaders together with the health department, and we created what we called an ad hoc COVID response team, just to bring people in together. And that's just one example how even last fall we began working, recognizing that we needed to connect the Department of Health, AHS, and physicians on the front line to work together in a more fluid, nimble, responsive way. This agreement gives us the process by which now physicians can bring forward requests for change, whether it's I want a different way of being paid, whether it is looking at changing how they're, whether or not you can do virtual mental health group therapy, for example, something that currently isn't covered by the scheduled medical benefits. So prior to this agreement, there was no place for that conversation other than me harassing Minister Copping on a regular basis. But now there's a process, there is a place, there's dispute resolution. So it is going to streamline what we need to do. It is going to make the work that has to be done to make things better for Albertans. It'll make it more efficient, make it more effective so that we can do the work that needs to be done and bring all of the stakeholders together, because I think the number one recognition over the past couple of years is there's nobody out there that knows the answer. And if we try to do things in a siloed approach, we're going to break it, because if I touch something over here, something down there is going to break. And that's what we're seeing right now, is the unintended consequences of a COVID pandemic, and none of us had a run-up to COVID to kind of practice. We did our best. We're nervous about the fall. We know COVID is still out there. We're predicting a really bad influenza season. Pressure's on the hospital already. We have to work together. We have to anticipate. We need to be smart. Saying to Albertans out there, it's still real. wash your hands, masks do work, whether you want to wear them or not, and just, stay home if you're sick. But be respectful if you do have to come into the hospital-based system this fall or into your family physician's office, so that they're doing the best they can, right? And we are working forward, but there are no immediate fixes, and these are solutions that, as we put them in, will start rolling forward, but it's going to take time.
Thanks. Tim, do you have a follow-up?
Yes, I do. You mentioned COVID there, and that you're nervous about the autumn. Obviously the new numbers show hospitalizations, case numbers are up. Are there any plans here to boost or alter the system before a potential autumn wave? Will things look any different in the coming months because of the pandemic?
Yeah, so there are plans in place. The first step really is, and we've already rolled out the new bivalent vaccine. So urging all Albertans who if they haven't got their booster in the last 5 weeks, last 5 months, to actually go out and get that for what you're eligible for. In addition, go get your flu shot. So we're actually going to be a campaign. We'll be starting in the next couple of weeks to do that, because it is actually going to be a bad flu season. So that's the first line of defense. AHS is putting in together plans to actually increase capacity, particularly in areas where there's there's stress already. Fortunately, we saw some of the pressure come off the system from last spring in hospitals generally around the province, but not necessarily in Calgary and Edmonton, where there's increased strain on the hospital. So AHS is working through their plan to add further capacity into the hospitals, and this is part of our overall approach as a government. We're spending $22 billion on the expense side this year, the highest ever in the province. That was a $600 million lift this year, a $600 million lift next year, a $600 million the year after that. So we are investing to build capacity in the system, be able to respond to the demands. But then there's no quick fixes, there's no easy fixes, and that's why this agreement is so important, because it actually provides the base for an ongoing partnership with doctors, so we can work together to solve these challenges.
Thank you, operator. Can you put through the next caller?
Janet Price, CBC.
Hi there. First question is for Minister Copping. I've heard from some family doctors who do not like this agreement. They say that the increases do not keep up with the costs of inflation that they're going to be experiencing in their businesses, so they'll actually lose money, and that the investment in rural recruitment and retention strategies is a pittance compared to the size of investment actually needed to make a difference. What makes you so confident that this agreement is enough to keep family doctors working in Alberta?
Yeah. So, well, thanks for the question. So this is, we heard loud and clear from the AMA and working through these issues that we needed actually targeted money, and we actually see that in the agreement where additional funds. It's not a straight one number across all of the sections, but we're actually targeting more money for family practices and that are in need. And the other key point I like to make is not only are we targeting money in this in rural areas, but quite frankly, this is the first step. It's in the conversations that we're having about the announcement we made last week on primary rural and Indigenous care, and the task force is looking at, okay, what else do we need to do? Part of this is also looking at different approaches. So it's not only about the amount of money, but how are we spending that money? Are there different models that doctors, family practices can use, which actually would ensure not only viability, but result in better care? So for example, a blended capitation model, when I know that some doctors are looking at, but we need to do this in concert with the AMA and with doctors to be able to roll that out, explain that there are other options to support family practices, and then how do we accelerate that? So, this agreement provides a basis for those conversations. The primary care initiative, which the AMA is also involved on the steering committee, will provide more opportunities for other ways that we can do things, because we know, this agreement won't solve all the problems, but it's a big step forward, not only in providing an initial infusion of cash to stabilize, but also looking at how do we use our programs better. Like, so for example, we're spending already $90 million for on rural physicians to be able for retention and attraction across the province. This agreement also provides opportunities for us to how do we look at that better and target that better, in different areas that we can put it in. So the reason why I'm so confident is because this is a partnership. It's ongoing communication. It provides us tools to be able to look at different approaches that we can use to support family practice and community practices, and then we're going to make changes as we go forward.
Thank you, Janet. Do you have a follow-up?
Yep, this is for Dr. Warren. So we're going to have a new premier within a couple of weeks and possibly a government with different priorities, different agenda, and yet this agreement contains this political promise to repeal the legislation allowing the government to unilaterally rip up any agreement with the AMA. So in your mind, what is an acceptable timeline for the Alberta government to pass that bill, and what would prompt you to terminate the lawsuit?
All right, so thanks very much. The members were very clear that the lawsuit is to stay in play until the legislation is successfully repealed. And so that's actually within this agreement. In terms of what's an acceptable timeline, I think legislature has to come in first. And I'm not a political scientist nor a minister. So as soon as possible, I think, would be the answer that I can give, because that's what members are looking for. Trust is something that is easily broken and is hard to rebuild. And for a lot of physicians out there, it's the actions that have been taken this year, it's the actions going forward into the future that really is going to begin rebuilding that trust. This agreement is with the Government of Alberta, and it's the Ministry of Health together with the Alberta Medical Association. The premier will be different after the leadership vote. There's an election next spring. It doesn't matter. Healthcare is healthcare, and patients need that care no matter who is running the boat. And I think my plea to politicians everywhere is stability is necessary to begin rebuilding and healing and making change. And introduction of more chaos is not helpful. So I would love it if healthcare was outside of politics completely, so we could focus on what we need to do. Our reality is it's not. It is tied into election cycles. So be cognizant that we as physicians need stability to do our jobs. And nurses need stability. Hospitals need to be there so we can move forward and do the things that we need to do in our day-to-day lives. And that additional instability is not helpful. So getting the legislation repealed as soon as possible will be great, and only once that happens does the lawsuit discontinue.
Thank you, operator. Can you put through the next caller?
Brianna Carson-Smith, Global News.
Hi, my question is for the minister. You were talking about AHS expanding capacity as we get into a difficult flu season and increasing COVID cases. Can you speak to more what that will look like? Are we going to see more of these overflow rooms? What about staffing? Any details you can provide?
Yeah. So we have been, expanding capacity across our entire system. And just to recognize that when we talk about our acute care system, it's a pipeline. So it's not only, like the first step in that pipeline often is EMS, then it's the emergency departments, inpatient beds, and then we need to do placement often into continuing care or different levels of care. And so, part of our $600 million is increasing capacity in each of those spaces. So, additional $64 million for EMS, plus we're doing a number of reviews right now, and I just received this week the APEC, the advisory committee on EMS, their final report, and looking at changes of how we can change processes within our system to actually reduce the times. We've invested $100 million into increasing 50 ICU beds, and all of those will be staffed and available for use by the end of this month. But just to be clear, it's ICU if necessary, not necessarily ICU. We want to make sure that we have that for surge capacity, whatever COVID or other health issue is going to throw at us. But if we don't need the staff in the ICU. We need them on inpatient beds to do that. And then on the continuing care side, we're building 1,500 additional beds across the province, and then we, as part of Budget 22, additional $200 million for capital for over the next 3 years. For beds on top of that, and we've just recently put on an RFP for renovations and renewals of beds across the province. Plus, AHS is working with docs, and quite frankly, conversations with the AMA docs. About, okay, how do we change our processes within our emergency departments to actually streamline the ability of people coming in, getting into inpatient, and then out the door to continuing care. So all that work is being done. We have more staff than ever we've had, in terms of nurses, in terms of doctors, and we are continuing to hire. I've been traveling the province, talking to AHS employees and healthcare workers, and also external stakeholders, including mayors and people working in continuing care and advisory committees. And part of that process is as well as identifying, okay, these are the challenges that we're facing. Here's what we're doing. What else can we do to solve this? And we're getting fantastic input, and we'll be bringing forward the results of that over the next coming weeks.
Thanks. Do you have a follow-up?
I do. I'm wondering, it's 980 people in hospital, 40 in ICU. We've really seen the tone of messaging around COVID change when the first shots were available. There were emails, there were billboards, things like that. With the bivalent, there's been literally zero advertising to get your vaccination rather than, especially compared to what we were seeing early in the vaccination process. So I'm wondering what sort of responsibility you take in terms of the messaging and how that's played a role in the numbers that we're seeing right now.
I'm going to apologize. We have a really low, the volume sort of dropped off at the very end in terms of the question. Can you just sort of repeat the last part of it? And I heard the intro in regards to the approach to vaccines. Sorry, the last part of the question I just didn't hear.
Yeah, messaging in general has dropped off when it comes to COVID-19. There hasn't been the same sort of urgency from the province when it comes to getting vaccinated, masking, things like that. I'm wondering what sort of responsibility you take with the numbers that we're seeing in hospital right now.
Yeah, so we continue to urge Albertans across the province to get whatever vaccine they're eligible for. We will also be, starting, not only our campaign for flu shots, but also urging people to not only get the flu shots, but the bivalent, at the same time, because that is still the best way to protect not only ourselves, but our healthcare system, and working with partners like the AMA to get that message out. So I would argue that we continue to push that. Now it's a choice of Albertans to get the shot, but we continue to push that message that that is the best way to protect yourselves. These shots are safe. Actually, with the bivalent, they provide even greater protection because they deal with not only the original variant but the Omicron variant, and then asking people to get their flu shot to be able to protect themselves, their families, and quite frankly our healthcare system.
Thank you, operator. Can you put through the next caller?
Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. This is for Dr. Warren. In the material we received this morning, the government noted that competitive compensation is important, saying that keeping Alberta physicians among the highest paid on average in Canada was a goal. How would you compare doctor pay in Alberta to other provinces, and specifically what does this deal do to change that or that anyway?
Okay, so Alberta has a couple of things going for it when you are a physician working. Number one, what attracted physicians into Alberta in the years past, so prior to 2019, was a vision. It was a vision of something called the patient's medical home. It was a vision of every Albertan having a primary care physician working in a team to look not only at treating your illnesses as they arise, but also in prevention. And then part of what we call the medical neighborhood, where we had specialists working within that medical home helping care for patients. And it was groundbreaking. Alberta led the way with primary care networks. It was leading the way with alternative compensation, recognizing that patients that are complex with multiple medical conditions need more appointments, but they need a multidisciplinary approach to treat all of the components of their diseases and illnesses to make sure they have the best quality of life, and putting the patient at the center of that. And that's what attracted physicians in. Physicians are compensated well in Alberta, but like everywhere, they went through a period of time where there was no increases. Physicians are businessmen. They, particularly in the community, they run their own businesses out of the money that they bill to Alberta Health. They have to pay leases, salaries, all of that sort of thing, and pay for their medical equipment. And as all Albertans know, inflation has been rough, and physicians, just like the local restaurateur, are facing that. Unlike Tim Hortons, we have a single-payer system, which means that when inflation goes up, I have to go to Minister Copping and say, hey, we need more money. And that's what this negotiation was about. The problem is looking at, is there a better way that we can now deal with the lack of physicians that we have? We have physicians who I would argue are very astute business people, because they are still practicing in their clinics despite having gone through a global pandemic. And as we all know, we've seen businesses close left, right, and center. Physicians are no different. We've seen closures. So this agreement is a beginning. It gives physicians an increase at a time when it's needed, but it also sets the stage for more. It sets the stage for us to sit down with all of the stakeholders to say, how can we do this better? Is there a better way to provide care to Albertans in a medical home, team-based care? How do we do that? How do we fund that? Do physicians want to work in one giant clinic, one smaller clinic? There's all sorts of things that need to be talked about. And that's really what this new primary care task force is going to be doing, is to look at these bigger issues and say, these problems were pre-existing, these problems are across Canada. Primary care has been struggling because you've got to be really smart as a primary care physician, because you're dealing with all ages from cradle to grave. And in the rural communities, you're in the community running your business, but then you're in the hospital looking after patients in the emergency room. And I'm a rural primary care physician and a business owner, so I totally get where this question's coming from. But the reality is physicians also want choice. And they need to be able to practice the way that meets their needs. And when I look at physicians, they're always there. They're always doing what they can do for their patients, but they're struggling. And so this agreement is the beginning of rebuilding relationships, but also trying to stabilize practices now so that we can answer those bigger questions going forward.
Thanks, Lisa. Do you have a follow-up?
Yeah, I have a follow-up for Minister Copping. Thank you. I'm wondering, Minister, the UCP has long argued that the province needed to rein in doctor pay, bring itself in line with other comparator provinces. So how does this deal represent a shift in the UCP's priorities or a continuation of those priorities? And how does it align exactly with the recommendations of the McKinnon panel?
This is, when you start talking about mutual gains bargaining, you look at everybody's interests, right? So we have joint common interests in terms of having viable practices, be able to, physicians who can actually provide the services to Albertans. And we know that we've had challenges, and this is even prior to COVID, particularly in rural areas, but since COVID, it's accelerated in terms of access primary to family physicians and primary care. And our objective is really, as a government, is we look at the costs that we put into the system. Is how do we actually ensure that we bring in the cost what we spend on doctors into line with other competitive provinces, right? So this agreement allows us time to jointly do that assessment and say where are the various and just to be clear, even though it's a single agreement over overall doctors, the reality is that different specialties and different sectors of doctors have different business models associated with that, and different rates associated with the fee for service models, and actually have different earnings. And there's even a recognition of this in the agreement in terms of dealing with internal equity issues. So saying we need to get more money to family physicians because quite frankly that's the workhorse. That is where we have the greatest shortages, and that's the bedrock of our healthcare system, and we need to get that working. So even when we've recognized in the conversation we need to shift some of the money there, we're going to do the assessment to make sure that our costs are competitive, and competitive goes both ways. It's competitive in terms of let's say if we're overpaying a certain area, then we'll drop that down, but if we're underpaying a certain area, that increases it up. But our objective as a government has been simply we want competitive pay for doctors. We need doctors in our system, but we need to work jointly together to find solutions, because it's not all about just the amount we're paying. Are we getting the best value from that? And does it work for doctors? Like I'm hearing from family physicians that some of them are spending far too much time in regards to red tape and which actually increase their ability to be able to perform services. And so how do we actually reduce that? What actually reduces their costs? Because really at the end of the day, it's after they get their revenue source from the government, what do they take home? And is that competitive they can do elsewhere? And actually, and it's not always just about the money. It's about the work-life balance. It's about, do I believe I'm contributing to a system that supports me? All these other pieces that Dr. Warren was talking about. And this agreement talks to some of that, plus the primary care initiative that we announced last week will focus on that more directly.
Thank you very much. Operator, can you put through the next caller?
Catherine Kurkowski, Alberta Today.
Hi, thanks. These are questions for the Minister. Minister, have you spoken with each of the UCP leadership candidates to receive assurance that they will bring in that repeal of Section 40.2 when the fall sitting is in session?
With all the leadership candidates about this deal, and I can tell you that they understand the importance of the deal, and they understand the importance of doctors in terms of moving forward.
Thanks, Catherine. Do you have a follow-up?
Yeah, and it seems like there has been in Alberta this cycle of, wow, costs are too high, we need to get our fiscal house in order, then there's cuts, healthcare workers leave the province, and then you need to bring in these recruitment and retention incentives, and then the cycle repeats. So when we're coming up to year 4 of this agreement with the market review, the global rate review, what's going to stop this same cycle from playing out?
Well, when we take a look at our well, first of all, let me take a step back. This cycle is, that you comment on, and I don't, it may be cyclical in Alberta, but the reality is that this is a challenge that's being faced across the entire country in terms of access to healthcare workers and quite frankly, in the entire first world. So we are moving on plans to address this long-term, medium-term, and quite frankly, short-term. Long-term, as part of Budget 2022, significant investment in post-secondary institutions, particularly for healthcare workers. We need to train and grow our own. So we've made that investment through post-secondary institutions across the provinces, nursing programs, LPN programs, healthcare aid programs, and other allied health professionals. In addition, we also understand immigration is a lever that we can pull. And so we are doing that right now, as I mentioned before, success in a number of locations across the province of attracting foreign trained doctors and working with the colleges to reduce the barriers associated with assessment so they can actually get them here quicker, and not just the College of Physicians and Surgeons, but also the nursing colleges, and actually streamlining that process as that work is going on, and then leveraging those that we have. We are fortunate in the province of Alberta. So, for example, pharmacists have the highest scope of practice, and so they can help out as part of a allied health team providing primary care to whether it be looking at prescriptions and renewing them without having to see a family doctor. And so all of this we're moving forward. So I think in terms of where we're going to be in 4 years, well, part of the work of this agreement, particularly with doctors, is how do we set up different method of pays that enable all allied health professionals to participate. How do we actually grow over the next number of years? Training our own, so we have more supply in all healthcare workers, and then streamline the immigration process. So, I appreciate your comment in terms of you get into the cut and additional funding and cut additional funding. We need to transform our system so we get out of that cycle. Part of that is the training. And part of this agreement is also setting up a long-term planning for doctor supply, which is in this agreement, and understanding how we're going to attract and retain doctors on that. And then part of it is actually looking at transformation and different methods of pay, so we continue to hold on to doctors. And quite frankly, we need to do this for other healthcare professionals as well.
Thank you, Minister, and thank you, Dr. Warren. That is all the time we have today. If you have any other questions, please feel free to follow up with our office. Thank you very much.
Thank you.
Thank you.